Good afternoon, everyone. Welcome to another event of In-Service Training Series organized by the College of Community Physicians of Sri Lanka in collaboration with the Provincial Directorate of Health Services, Western Province. Under this series, we had a session on correct stock management of vaccines and cold chain maintenance on the 20th of November, conducted by Dr. Nimal Gamagedara, consultant epidemiologist. Everyone appreciated that session, which was conducted in Sinhalese medium. Following that, there were multiple requests to conduct the same program in English medium. Dr. Nimal Gamagedara kindly agreed to be the resource person for this repeat program as well. Let me welcome all of you who have joined today's session. We are honored to have with us Dr. Nimal Gamagedara, consultant epidemiologist from the Epidemiology Unit, Ministry of Health, as our esteemed speaker for this session. Over to you, sir.
Okay. Good afternoon, everyone. Can you all hear me?
Yes,
now?
sir, we can hear you, sir.
Okay. So first of all, I would like to thank Department of Health Services from the Western Province, and also the College of Consultant Committee Physicians for organizing this webinar on routine immunization, vaccine management, and cold chain monitoring. And this is the second discussion on the same topic. Last time we did it in Sinhala medium. Now, as there were requests for us to deliver the same discussion in English. Now, today I will deliver it in English. The same discussions, only changes the medium that we have these discussions today. Now, first of all, as responsible and accountable healthcare staff, especially in the preventive health sector for immunization in this country, we all need to know about the objective of our national immunization program as a country. So now, as you can see my screen, the first most objective is to reduce the morbidity and mortality and also disability due to vaccine preventable diseases in the country. And next national immunization program objective is to eradicate poliomyelitis in parallel to other countries in the global arena from the community. And the third third objective of the national immunization program is to eliminate measles, rubella, congenital rubella syndrome, neonatal tetanus, and diphtheria from the country. So far, except diphtheria, we have been able to eliminate measles, rubella, congenital rubella syndrome, neonatal tetanus because of the teamwork, including grassroots level primary healthcare or public healthcare staff, as well as the health professionals within the Ministry of Health, Sri Lanka. Now, you all know Sri Lanka is not a country anymore for measles elimination, as we have already re-established the disease transmission within the country, even though we have controlled it to a very much lower level, still it is going on. And so therefore, today's discussion is also very much important in achieving the measles elimination status again. Now, to achieve these national objectives, one of the main components is to ensure that recipients, especially our children, receive a good quality potent vaccine dose whenever they receive their due vaccines within our immunization clinics. So to ensure the quality of vaccines being used in our routine immunization programs, this is one thing that we need to understand. As all of us, like all of us, within any given vaccines, we have biological components or molecules. So they will degrade or they will die gradually since its production in the factory. So with this graph, you can see the potency of the vaccines here, the potency of vaccine from its lot release get gradually decline over the time. So therefore, in general, shelf life of any given vaccine extends only up to 24 months. That is 2 years. Within 2 years of vaccine production, it will expire. So therefore, we cannot use all those expired vaccines because it has already lost its potency, triggering the development of antibodies within the recipient. So therefore, our effort with you all is to ensure that these vaccines are used in our routine immunization program well before its expiry date, because it is one of the major components that ensure the quality quality and safety of the vaccines. So now, so that means we need to always make sure that the vaccine dose that the recipient receive is of a good quality potent vaccine. To ensure the potency of the vaccine or quality of the vaccines, we need to do 2 things. That is, the first one, we need to properly maintain the cold chain system where we store vaccines from its manufacturing at the factory until up to it is being used in our routine immunization program. The other component is the expiry date, as we have already discussed. Now, to achieve the objectives of routine immunization program, there are 10 key components that we need to make sure they are in active forms, right? So we cannot stop at any point in time. So we need to make sure all these 10 components are still active and live, right? So first, 2 most important factors that in achieving our national immunization program objectives are routine immunization vaccine management and also the routine immunization vaccine cold chain monitoring and management, together with other 8 components that you can see in my screen. So today we are going to discuss about the first 2 components, that is vaccine management and cold chain monitoring and management. So now, when it comes to our routine immunization vaccine management, so before we release all the vaccines that we get from overseas to districts, so there are many things that is being taken place to make sure the vaccines being released from the central vaccine store to the districts are safe and effective. So first most thing is annual estimating of our vaccine requirement. So this is one of the main components that make sure the quality of the vaccines. So that before we release all these vaccine to the districts, so the things that we do at national level, this is for your information to understand how much of effort we have been doing to ensure the quality of vaccines, right? The first thing is we procure only WHO pre-qualified vaccines. So any vaccines being purchased or procured and released to the districts are only from WHO pre-qualified vaccines. The other thing is, even we use these WHO pre-qualified vaccines, before we get the vaccines to our country, there is an expert committee at National Medicinal Regulation Authority by which assess the pre-requirement of all these vaccines, especially the quality aspects. And when they send us the assurance, only we request all these vaccine consignments to be released to Sri Lanka. Now, at the airport, again, we assess the pre-arrival cold chain status from its factory to our airport. Whenever there is a temperature excursions and any doubt, we do not accept all these vaccines. We send them back to their suppliers without accepting. So when the cold chain status at the airport arrival is all right, so we send still the necessary documents to MRI, where we have experts to assess again the status of all these vaccines, where they send us lot release certificate saying that these vaccines are safe to be issued to the districts and to use in national immunization program. So then only we release all these vaccines from our central vaccine stores, still in a controlled distribution method. Why it is called controlled distribution? Because we have already discuss and inform. We have already informed through our regional epidemiologists to all our medical officer of health, as well as our other public health staff working in the field, including public health midwives, PHIs, and all other supervisory staff. So there are maximum stock levels to be, that can be kept at each level. So when it comes to MOH level, you can keep only up to 2 months requirement. When it comes to RMSD at district level, they can keep only 3 months requirement of the district. And when it comes to national or central vaccine stores, we can keep only up to 6 months required. That is to, again, maintain the quality of the vaccines. So in estimating vaccines, either you can't underestimate as well as you cannot overestimate. The both will have problems. So if you overestimate, the vaccines get expired, and then there will be a financial loss. So if you underestimate, there will be shortage of vaccines at any point in time. So then our national immunization program objectives will not be achieved if there is a stock out. So therefore, we need to be very careful in estimating the vaccine. From district to MOH and MOH level to field level, this vaccine estimates being done annually is very, very important for smooth distribution of routine immunization vaccines, ensuring the cold chain status of all those vaccines, which ultimately ensure the client receive, as I said, a good quality vaccine dose at the time of vaccination. At the national level, it is very, very important for smooth distribution as well as procurement of routine immunization vaccines annually. So there are 3 methods of estimating vaccines at each level. So first is based on our target groups. So second is based on our previous year's consumption. And third one is a combine of the above 2. For districts as well as MOH level, we do recommend to estimate your vaccine requirement based on your previous year consumption, because we have found during our EPI and VPD reviews, this correct information or accurate information on births and infants are not available at district level, even though we have number of births registered, number of infant register, there are big discrepancies. So therefore, because of that reason, we do recommend for all districts and MOH to estimate their annual vaccine requirement based on their previous year consumption, because again, you have all this information on vaccine consumption at your MOH office vaccine movement register if it is maintained regularly and accurately. If it is not maintained regularly and accurately, there will be some problems. So if you have any issues, you need to discuss with your regional epidemiologist how to overcome all those issues in estimating your annual vaccine requirement. So, how to estimate all these vaccines, right? So, and when to do this annual estimate. So, as you can see in my screen, now at the end of each year, each MOH office, at each MOH office, they need to prepare their annual estimate after the last immunization clinic being conducted within his or her MOH area, because you don't need to wait until the returns from PHMs, especially this MCH 5 to 7. You don't wait to you don't want to wait until they send their MCH return of 5 to 7, because you have all the information in your vaccine movement register. Therefore, you need to prepare your annual vaccine estimate at the end of the year after the last immunization clinic for the year. So then these vaccine estimates need to be sent to regional epidemiologists before January 5th of the new year. So now if you consider 2025, so now, by now, we have already shared the tools that you can use in preparing your annual vaccine estimate to all regional epidemiologists. So therefore, at MOH level, please contact your regional epidemiologist. If you have not yet received all these tools, it's not, I mean, difficult or complex tools. It's a very simple tools which is being done, which is being used over the years to estimate our vaccines. Only small modifications that we have done to those tools. Now, from all districts, they need to send their annual vaccine estimate for the districts together with their vaccine distribution plan for the entire year before 5th of the January 2025. Now, I have been receiving some calls from our epidemiologists, sometimes MOHs, on certain issues with regard to these estimates, but still you can prepare all those vaccine estimate after discussing among yourself. And also, if you have any issues, please contact your regional epidemiologist. Now, one issue in preparing annual vaccine estimate, that is mainly for BCG, because BCG distribution take place directly from RMSD to particular hospitals where the deliveries are taken place very commonly, right? So mainly base hospital and above where VOGs are available. So the particular MOH office will not receive the vaccine distribution details when it comes to BCG to each and every MOH office. So therefore, as I have explained to all REs during our RE conference at Gampaha, so all the regional epidemiologists need to collect the vaccine usage on hospitals, that is BCG, directly from those hospitals to the regional epidemiology unit. So therefore, these annual BCG estimates need to be prepared by the RE, because MOHs cannot do the estimates due to that issue. So therefore, please consider all these things in preparing your annual vaccine estimate. So now the vaccine distribution within the district. Once you prepare the annual vaccine estimate for the new year, now you need to identify your 1 month requirement for each and every vaccine, including immunization logistics, such as syringes and safety boxes, right? So now when you prepare and when you identify all these vaccines and immunization logistics, your 2 months requirements you need to estimate. So if you know your 2 months requirement, together with the balance available at your vaccine movement register, and you need to request the vaccines and logistics to complete your 2 months requirement in the given format from the RE unit before 5th of the every month. So when RE receive all these vaccine requests from all the MOHs before 5th of the January, so then from RE unit, they need to prepare vaccine distribution plan based on MOH's vaccine request forms, and the vaccine distribution plan should be prepared by the RE and handed it over to RMSD staff. Then RMSD staff should prepare their vaccine distribution plan for entire year. Ideally, this vaccine distribution plan from RMSD should be a fixed one, and it should be within first 2 weeks of the particular month, because all RMSDs, almost all RMSDs are given even this freezer trucks, and also some, if the particular RMSD has not received freezer truck, they have to have a permanent distribution transport facilities. So then anyway, within 2 weeks of first 2 weeks, RMSD need to distribute all these vaccines to the particular MOH officers within the district. Now, so if particular MOH has not, if any MOH is not sending their vaccine request to a regional epidemiology unit before 5th of the following month, so this will not take place regularly. So if that is not happening, there will be many things that take place and will affect the quality of the vaccines, as we have observed through many incidences that has been reported to us from all the districts. So therefore, and apart from sending the vaccine request, now there is an online system from the Ministry of Health that is called SWASTA system. In some districts, yes, MOHs need to request vaccine through this online SWASTA system. At the same time, they need to keep this manual request to the regional epidemiologists to make sure that the vaccine distribution within districts take place very smoothly. So on receiving the vaccines, it is very important these things to be considered. Whenever that take place in a fixed schedule, there should be a responsible staff member at the MOH office to accept all these vaccines. And that time, there should be a responsible person from RMSD to hand over all these vaccines and logistics to the MOH office. So that means from RMSD, they cannot send vaccines only through minor staff or health assistants and driver. So there should be a responsible officer from RMSD to make sure all the vaccines are distributed safely. So now on receiving the vaccines, MOH office responsible officer should check all the details, whether they are receiving only requested doses of vaccine, their VVM status, expire dates, batch numbers, whether they are all correct. And then only they can accept all these vaccines and logistics. Once they receive vaccines, they need to enter all this information into vaccine ledger by the health management assistant within the MOH office, and then the particular responsible officer at the MOH office, they immediately need to transfer all these vaccines to ILR, that is ice-line refrigerator. So now, when you send vaccines from MOH office to the field, again there is a method of, recommended methods of distribution of all these vaccines from MOH office to the field vaccination clinics, so which I will discuss later. Right? That this is the method that we expect on vaccine management within the districts. So now always we are following a method called push method in vaccine distribution. That is, so always we try to distribute vaccine from higher level to next lower level. So for example, always we try to distribute vaccine from central vaccine stores to RMSD to MOH office, from MOH to field office, field immunization clinics. So we do not expect RMSD staff to come and collect vaccines, because there are some incidences where when RMSD staff come and collect vaccines, some expected aspects of quality maintenance are not taking place on such situation. For very recently, we got only minor staff member together with driver to our central vaccine stores from districts to collect vaccines and logistics. So we didn't issue vaccines and logistics to that district because we didn't have any responsible persons to accept all these vaccines. So therefore, please, that is this method, sending vaccine from higher level to the next lower level, is called push method, which we have evidence for good quality maintenance of all these vaccines. Now, whenever you receive vaccines, the management of all these vaccines within the ice-line refrigerator is very, very important. As you all can see, all the live vaccines together with their diluents, we need to store in ice-line refrigerator in the lower buckets, right? So all other vaccines we can store, and we need to store in the trays in the upper layer. So now that is for keeping the vaccine. And the method is we must follow the first come, first use basis, right? So we need to use the vaccines you received on previous month before you using the vaccine received to you thereafter. So we have seen many times when we visit MOH offices during our RE conferences on our supervision visit, this principle is not being practiced. So this is very, very important. So each and every point in this management, make sure the quality of the vaccines being used in our routine immunization program. So therefore, again, I will repeat it. All the live vaccines together with their diluent should be stored within the lower racks of the ILR, while all other vaccines are stored within the upper racks within the ILR. And so again, for each and every vaccine type, we need to have 2 containers. One container should be labeled as new. The other container should be labeled as old. Always, we need to keep the vaccine you received previously in the old box and vaccine you received subsequently in the new box. So always we take vaccines from the new box once the vaccines in the old box is over. So that is to make sure we use first come, first basis, right? So then another one is, when you send vaccines to the immunization clinics, you may get unopened vials as well as open vials from the field immunization clinics. So when you get all these vials, you need to store those vaccines in 2 containers. That is, one container should be labeled as written open, the other container should be labeled as return unopened. Then you need to store all return unopened vaccines in the return unopened box and all open vials in the return open vaccine vial box. When you take vaccines out from the ILR, next day, first you use return open. If you are not having adequate enough doses in the return open box, you go to return unopened box. So if you have not got enough doses in the return unopened box, then you go to particular vaccine container inside the ILR labeled as old. If you don't have enough vaccine doses in the container labeled as old, then only you go for new box. So this method need to be followed by all the MOH and staff in managing your vaccines within your facility. This will also apply to the RMSD level, except this return open and return unopen things. So therefore, please make sure these principles are being followed in managing your all vaccines within your MOH office and the clinic. Now, very briefly about the cold chain. Now, the cold chain include human resource devices like our ILR, freezer, temperature monitoring devices. Those all are coming under devices. HR means MOH, public health nursing sister, SPHM, SPHI, and all other public health staff in the MOH office. So then materials, the books, returns, registers, all are coming under returns. So all these three components include collectively known as cold chain to make sure child and client receive a good quality potent vaccine dose at immunization clinics. So how this is being taken place, this is how the vaccine distribution should take place. Always we need to get vaccines from vaccine manufacturer to the central vaccine stores, from central vaccine stores to the RMSD, from RMSD to the MOH, from MOH to our clinics center. Now, so at each and every step, these are the temperature limit that we should store vaccines. From manufacturer up to district level, we can store vaccines either from 2 to 8, or for some vaccines, like live vaccines, we can still store them between 15 to 25 minus centigrade. That is OPV, BCG, and MMR. As being the live JE is also a live vaccine, JE, but due to manufacturer's recommendations, we do not store them in freezing compartment. But so all other vaccines except BCG, MMR, and OPV, all other vaccines, including all these vaccines, we can store between 2 to 8, and apart from all other vaccines, the BCG and MMR and OPV, even we can store in the freezer compartment. That is, actually we store at central vaccine stores and even at district level, OPV, MMR, and BCG, we store in minus temperature. So at MOH level and the field clinics level, we need to keep the temperature when we transport vaccines from MOH office to the clinics and clinics to the MOH office again at 2 to 8 centigrade. So the facilities that is available to store vaccines each level. So at from manufacturer to us receiving vaccines at the airport. So they need to package according to WHO performance quality standards. We do check whether they have packed all the vaccines according to these standards. If it is not, we will not accept all these vaccines. When it comes to central vaccine stores and RMSDs, we store vaccines in walk-in cold rooms, freezers, and ILR. So when it comes to MOH office, you have only ILR to store vaccine, and also you have freezers to make frozen cool packs, and also you have cool boxes for you to use in an emergency situation, and you have freeze protected vaccines carriers to transport vaccines from your MOH office cold chain to the field clinic. At field clinics, we have only freeze protected vaccine carriers. So now monitoring temperature at each level, we have more than one method to temperature, more than one method to monitor temperature. Why? Because we don't want to lose monitoring of temperature due to failure of any other method. So therefore, we always have different methods of cold chain monitoring. So when it comes to vaccine manufacturer level, so we have temperature monitoring devices called Q-tag and log-tag. So when we receive vaccines, we do check all those temperature limits. So at primary stores, that is central vaccine stores, and the RMSD level, you have column thermometer, CTM. That is one thing. We need to monitor temperature twice a day with column thermometers. And fridge tag, we used to monitor temperature for last 30 days. And this RTMS means remote temperature monitoring system. That is to make alarm whenever there is a temperature excursions to accountable responsible persons, such as RMSD OIC, regional epidemiologists, and cold chain monitoring staff at even central level. So RMSD level also same, but when it comes to MOH level, you have column thermometer and fridge tag for you to monitor temperature daily. Then how to transport vaccines? So from manufacturer to our central vaccine stores, it is only through air transport. From RMSD to central vaccine stores to the RMSDs only through insulated vehicles. From RMSD to MOH office, again, it is through insulated vehicles. So now so far we have provided these insulated or freezer trucks to some RMSDs, and for other RMSDs where we haven't got still the vaccine transport vehicles, that is freezer trucks, we have received and purchased these vehicles. They are at the level of ministry. So soon we will distribute all these vehicles to other RMSDs where you don't have freezer trucks. So accountability and responsibility of all these things being taken place as it is expected lie on these responsible bodies. So at airport, up to airport, it is manufacturer and the supplier. For central vaccine stores, it is OIC at central vaccine stores, and also national focal point consultant epidemiologist is responsible for these cold chain and maintenance. And when it comes to RMSD level, it is OIC of the RMSD and regional epidemiologist. And when it comes to MOH office, it is the MOH. So he can delegate his responsibility to other staffs, maybe MOH, maybe PHNS, maybe SPHM, maybe SPHI, but total responsibility, accountability is on MOH office. So whatever the things happen due to any cold chain failure, the MOH is responsible. He need to make sure that all these things are implemented at his or her level. So when it comes to vaccine clinic, it is the vaccination staff. It may be public health midwife, maybe public health inspector, maybe SPH, maybe PHNS, maybe MOH and MOH. So this is how the cold chain is maintenance and responsibility transport, facilities, temperature monitoring, and will all take place at our system. Now, the cold chain management, as I already discussed. So now, what I wanted you to know in this slide is that these green ones. So green ones, you can see lyophilized. So now we have 3 vaccines. That is BCG, lyophilized means the freeze-dried vaccines. We have 3 vaccines. That is BCG, JE, MMR, right? So these all vaccines we can store between 2 to 8. For, as I said before, these green ones, that is the live vaccine, you can even store between 15 to 25 centigrade. So that is why we store BCG, OPV, and MMR in freezers up to RMSD level. So even JE can store at 15 to 25 minus centigrade, but due to manufacturer's instructions, these days we do not store live JE in freezing compound. So that is one thing. And however, all the other vaccines, so all OPV, the OPV vaccines we can store in both temperature limits. And the other most important thing is diluents. We cannot, the diluent should never be frozen and used in our immunization program. So therefore, all the diluents should be stored between 2 to 8 centigrade during our in our immunization program. For your information, even diluents, if you have more stocks, even diluents, we can store them at dry stores, but we need to make sure that all the diluents are kept between 2 to 8 centigrade temperature limit for more than 24 hours before they are being used in our routine immunization program. Now, in the cold chain maintenance in a given refrigerator, I wanted to discuss with you most important 2 points. That is, the temperature within the ILR should be kept between 2 to 8, and only 60% of the vaccine storage capacity we can use for storing the vaccine. So nowadays, I have seen many times when I receive the vaccine request from form from our districts, especially with regard to HPV, in some MOHs, they are keeping more than 800, 900 doses of HPV within their ice-lined refrigerator. So as HPV vaccines coming as a single dose vial, if you store 800, 900 doses of HPV in your ILR together with all other vaccines, definitely you have exceeded 60% of your vaccine storage capacity. If you exceed 60% of your vaccine storage capacity, that means your cold chain will not be maintained well and properly. Therefore, cold chain status of the vaccines will be not good. So therefore, do not exceed 60% of the vaccine storage capacity from your refrigerator. So the other most important thing is the frequency of and duration of the ILR door opening should be minimum. Because that means you should monitor temperature. When you have immunization clinic on a particular day, you should take vaccines out, and also you should monitor temperature at the same time. So you should not open your refrigerator door to monitor temperature at one time and to take vaccines in another time on the same day whenever you have immunization clinic. If you don't have immunization clinic on the particular day, you can open the door and monitor temperature and close the door immediately. At the same time, when you take printouts in every 2 weeks, you need to do all these 3 things at the same time, right? So therefore, it's very important to keep it minimum for opening the door of the refrigerator. And the other thing is, always you should have contingency plan at your MOH office. So we have distributed the formats and the the posters about the contingency plan to all regional epidemiologists for them to distribute among all the MOHs. I think you may have already received all these posters. Accordingly, you need to prepare your contingency plan and display it immediately above the ILR. So this should be in place every time. And then, however, diluents need to be, that I have already discussed with you. Another thing is, depending on the temperature in your region, there will be mist collected inside the refrigerator. So therefore, you need to clean the refrigerator, hopefully, depending on the temperature, once in 2 weeks. So if you don't have enough water collected inside the fridge, it is more than enough to clean the refrigerator once a month, right? So please consider all these things. But at the same time, you must not take vaccine stock counts every month. So I have seen every month some MOH, in some MOH officers, they do count all the doses for each and every vaccine to update their vaccine movement register. So if you maintain your vaccine movement register, you don't need to take vaccine stock counts every month. However, if you have any doubt, you can take vaccine stock count as a team, including MOH, AMOH, PHNS, SPHM, or whatever the responsible staff. So then you need to record that observation in your vaccine movement register, why you have taken the stock count, and what is the results, what is the gap, and underlying reason. So otherwise, never ever take vaccine stock count every month. So that will affect your cold chain status. So that is another message that I wanted to give. So next, so cold box. So for your information, I know, so we have two types of cool boxes. The left side of the screen, it is the previous one, cool box that we have distributed, where you don't have enough, separate space for keeping cool packs. But on the right-hand side, you have this new cool box. So this has been distributed to each and every MOH office. If you haven't received, you contact your RE. Definitely, they will. You will have all these cool box in your stores or inside your cupboard, right? So we have already distributed to all the districts and all the MOH officers. So now these are very, very important for you to use in emergency situation. Now, for example, say all the roads are blocked due to some disasters. There is no power supply. So you cannot implement your contingency plan immediately. So you need to keep all these vaccines safely, maybe for maybe couple of days. So in that situation, you can keep all these vaccines inside your big cool box. So now for your information, we need to load with frozen cool packs. So now you need to store cool packs as it is shown in this figure. And then if you close the lid of this cool box very tightly, you can store vaccines for 96 hours, even outside temperature being 43 centigrade. That is, you can keep them for 4 days, right? For large cool box, that is for large cool box. If you have this small cool box, that is only 48 hours, that is freeze protected vaccines carriers. Hello? Meeting again. And so now, so the small means you are freeze protected vaccines carrier. So you can use either as a contingency measure or outreach sessions. But in our country, you don't need to have outreach sessions in such a way that you can use all these pool box, because we have established immunization clinics at each and every close proximity in the communities, right? Can also be used to store frozen cool packs during emergencies or campaign. Even you can keep cool packs to be used in an emergencies, even using these cool boxes. Now, how to prepare cool packs and how to get cool packs from your freezer. Now, first of all, you need to make sure that all these cool packs are full of water. There is an upper limit that you can fill up the cool pack. You need to make sure that all cool packs in your freezer has got enough water up to its level. So now we have observed sometimes during our visit to MOH office, sometimes you have only half filled cool packs. That is not recommended. So now you need to arrange cool packs as you can see in the screen. So now we haven't seen any MOH office where you have kept all cool packs in this pattern, right? And on our supervision visit, you have just thrown out these cool packs to freezer. They are not properly organized inside the freezer. So now this is another thing. Now, when you get the cool packs being used in your routine immunization clinic, you need to keep these unfrozen ice packs for freezing only from one side, right? So then they need to be kept at least 24 hours between 20 to 25 minus centigrade for all these cool packs to be fully frozen. So when you have all these frozen cool packs, as you can see in the screen in the bottom line, you need to get all these cool packs from one side and kept in the other compartment from where you can take all these cool packs to be used in your vaccines carriers. So that means you need to make sure that each cool pack is full of water, and then each cool pack has been there within the freezer, which is between 20 to 25 minus centigrade for more than 24 hours before they are being used in your vaccine transport from your MOH office to the field clinic. So that is the basic requirement. And this is freeze-protected vaccines carrier, which is being used in our MOH office. So all the MOH offices in the country are given adequate number of freeze-protected vaccines carriers. You know how to use this one. This is given in this one, this screen. Now, the most important thing is you need to load all these cool packs at least one day before you use this vaccines carrier to transport vaccines. So that means you need to say you have immunization clinic tomorrow, then today you need to keep all these cool packs, frozen cool packs within the freeze-protected vaccines carrier before you leave the MOH office today, and on the following day, after drying out this vaccine, this is called vaccine loading space. This vaccine's loading space need to be clean and dry before you load vaccine. So then you need to close the compartment with this lid and this foam pad, and then this lid very tightly, and then you can send vaccines to the MOH office. So whenever you have a public holiday being the following day, so then according to our guideline, you need to replace all these cool packs before loading the vaccine. So now to make it very clear, even if you use new cool packs on the following day, there won't be harm. That will be a good practice even, but that is not compulsory. But areas like Hambantota, Matara, maybe where the temperature is so high, even northern province or eastern province or Uva province, still you can replace with new cool packs before you load in the vaccine. So this is the older one. So now this is not recommended to be used in our routine immunization program because you have adequate number of freeze-protected vaccines carriers at your level. For any reason, if you happen to use these vaccines carriers, you need to make sure that you should keep all these vaccines in a separate plastic container, and then you should be kept inside the vaccines carrier just to prevent freeze damage by touching all vaccines directly with the frozen ice pack. So if you use this type of vaccines carrier, you need to condition all the cool packs before they are being kept inside the vaccines carrier. I think you know these things, but for completeness, I have included all these things. But when you store vaccines, these unopened vial, especially loading unopened vials here in the vaccine freeze, this freeze-protected vaccines carrier, you don't need to use another plastic container. But for open vial, it is recommended to keep open vial in a small polythene bag to prevent contamination. But for other vaccines, you should not keep in another plastic container and then that plastic container inside the fridge, inside the freeze-protected vaccines carrier, right? Now, because of the time, now I will move forward the others one. Now for temperature monitoring. The cold chain temperature monitoring, you have this column thermometer, right? You have column thermometer. You may have this freeze tank and fridge tank, and this is also another method to monitor temperature, right? Now about column thermometer, it is the most reliable temperature monitoring devices for the ILR at MOH office. Why? Because it gives the temperature value at the time of inspection. So it cannot store previous records, but at the time of your inspection, it will give the direct value. Using this one, you need to monitor temperature twice a day in the given MOH office. And at the same time, you need to check vaccine vial monitor of the OPV vial, right? So how to and whom to monitor temperature. So that is given in this slide. The MOH can assign somebody after confirming that particular person can monitor temperature as it is expected, right? It should be twice a day and need to record using the new temperature monitoring record that is sent to you, and it is also available in our website and sent to you even 2 years back. That is early 2023. Now we are at the end of 2024. But even in API VPD reviews, we have already seen still MOH offices, some MOH office, at some MOH offices, the old version of temperature monitoring chart is still using. Now, for any issues, no, it is not enough to record the temperature, but the person who record temperature should be able to inform or should be able to know and decide when to inform MOH and when not to inform MOH. So that it should be trained to that particular person. When there is a temperature value above 2 to 8, so above 8 or below 2, that should be informed to MOH office, and MOH should have taken appropriate action. So now this is the temperature monitoring that I was talking about you. So this was issued early 2023 to all MOH officers, but during the API and VPD reviews at district level, we have seen this is not being used. Still in some MOH offices, they are still using older versions, right? So you need to use this one. Please contact your RE for more information. Your temperature reading should be recorded here by a small PROS, and you need to see fridge tag every day, one time per day, from where you need to check freeze tag, the freeze tag alarm, whether it is alarm or not. So you need to see maximum temperature and minimum temperature. At the same time, you need to record VVM of OPV because it is the vaccine or VVM which is most sensitive to heat exposure, right? So therefore, that is why we check OPV VVM status. So then this is a responsible person assigned by the MOH, the name, and when vaccines is arrived, whether cold chain status okay or not, whether if you have failure, you need to record it. And if you received vaccines twice in a month, so then if you have vaccines received 2 times per month, so again, you have to record. And if you clean the refrigerator, you need to record all these things. And if you have any temperature excursions, you need to record in the second page of this chart, right? You have another page of this temperature chart where you need to record any temperature excursions that took place any time of the month, right? So then this is freeze tag. So this gives us message whether the temperature inside the ILR has gone below 0. So now if you have the tick like this, that means within last 24 hours, that means from the time that you have inspected last time up to the time that you are inspecting again. So usually it has not, the ILR temperature has not gone below 0. If you have a cross, that means the temperature has gone below 0 and kept below 0 more than 1 hour. Then only it will show you a cross. So this is not necessary. I mean, you don't have every time to have a freeze tag inside the refrigerator if you have freeze tag. From the freeze tag also, we can see the same information. This is also term again. MOH is the responsible person. MOH can assign this duty to another person after confirming that he or she can record the information from freeze tag, and if he or she knows when and what to inform MOH office, right? So next one, freeze tag. This is another temperature monitoring devices we have distributed to all MOHs. So now from this one, you can record, this device can record temperature for last 30 days, including minimum, maximum, and average. So it display shows either cross or tick. If you have the tick, that means from last 12 midnight up to the time that you inspect this one, the fridge has not gone to any temperature failures. That means either above 8 or below 0, right? Now you have the date here, you have time here, you have the temperature value here. You have set button here, you have read button on your right side. When you press the read button, you will get the maximum temperature value here with letters max. If you press this read button again, you will get letters min here and temperature, that is minimum value, during the period from last midnight until up to the time that you inspect, right? At the same time, you will have an arrow showing here. If the arrowhead is above, that is maximum, arrowhead below, that is minimum, and the arrowhead will move one by one to your left side, depending on the time that you press the read button. You can do it and experience how it is work with your fridge tank. However, you need to make sure that within 10 minutes of taking it out, you need to keep it inside again. Otherwise, that the higher temperature will be recorded in the fridge tank. Now, the alarm. So alarm will trigger if the temperature goes below minus and kept it minus more than 1 hour, you will have cross mark. And if it is if the temperature goes above 8 and kept above 8 for more than 10 hours, again, the temperature, this mark will be as a cross. So then if there is a cross mark here, then it should be informed to immediately MOH. And MOH need to take immediate measures to make sure the vaccines are safe to use in our immunization program, right? So then with this fish tag, you need to take printouts every 2 weeks and inspect. So whenever you take printout, the MO should read the printout and make sure that the temperature excursions beyond 2 to 8 has not occurred inside the ILR, and therefore the vaccines are safe to use in your routine immunization clinics. So we have seen many times the MOHs have not seen, observed, not correct actions taken whenever there is a temperature failure. So, but during our API reviews, yes, with these, regular monitoring, majority, they have seen and corrective actions has taken. But whenever there is a failure, the common observation is there is no responsible person has seen or evaluated and inspected the report well. And cold chain monitoring, again, with the VVM. So all the vaccines being used in our immunization program have a vaccine vial monitored. So that is, you can see any vial like this small circle with the inside square. The square is white. If it is clearly white, it is stage 1. With time, the inside square will be faded. So if you have the faded square, but still lighter than the outer circle, it is stage 2. And if it is same, if you cannot see the square, that is stage 3. If the inner square is dark, that is more than the outer circle, that is stage 4. Stage 3 and 4, we cannot use anymore in our immunization program. So therefore, at every time when you receive vaccines to your MOH office, you need to check VVM. When you send vaccines from MOH office to the clinics, the person who put vaccines inside the freeze-protected vaccines carrier, they need to make sure VVM is in either stage 1 or 2. So again, at the immunization clinic, before vaccinating each and every client, so before vaccines being used in the immunization clinic, the responsible officer at immunization clinic, they need to check all these things. They need to check again whether VVM is all right, expiry date is not passed, and the vaccines in good quality conditions, they need to all check, right? So this is very, very important. For your information, so we use only WHO pre-qualified vaccine vial monitors containing vaccine, right? So only WHO pre-qualified vaccine vial monitors are VVM2, VVM7, 14, and 30, right? For example, this is the least heat stable vaccine vial monitor, that is VVM2, right? So even if you keep the temperature between 2 to 8, that is average 5, you can keep with vaccines, these vaccines, that is least heat stable vaccines, for 225 days. So that is why we decided to keep vaccines only 2 months requirement within the MOH office. So that means only maximum when you receive vaccine, any vaccine, if you follow that principle, you only can keep vaccine within your ILR for 60 days. More than 60 days, you don't need to keep vaccines, any vaccines more than 60 days, if you follow that principle, right? So therefore, this need to be checked. And why I am saying and highlighting this one, very recently we got one incident from one district. The TT has given even 2 months after its expiry. And there was a big issue And then there was an investigation going on. And then, the first most thing is the giving that vaccine is not effective for that client, right? So therefore, this is very, very important. That is why we have made all these steps to make sure the quality and safety of the vaccine. So now, I have 2 more slides only, right? What to do in a cold chain failure, right? So the cold chain failure can take place in either directions. So now say if the temperature has alarm, if the fridge tag alarm triggered and you observe that the temperature has gone above 8 centigrade and kept above 8 centigrade for more than 10 hours. So then what can you do for those vaccines? The first most thing is to make sure that your ILR is still having the trouble or the problem of cold chain maintenance. If the ILR is still not maintaining the cold chain between 2 to 8 centigrade, you need to immediately transfer all vaccines into your MOHOP's big pool box after preparing or arranging pool packs as it is recommended. Right? That is the first most thing. The second most thing is you need to take a printout from the fridge tag. Then you can get information for how long this temperature deviation has been there and to what maximum temperature it has gone, and that kind of information, whether it is there for such a long time or whether it is recurring even. So many information you can get from the printout of the fridge tag. So then after all, so if it is temperature above 8 centigrade, you need to check VVM of all the vaccine vials. If the VVM is within the usable limit, that is stage 1 and 2, you can use all these vaccine in your immunization program. So then again, you need to inform your RE, you need to make a report, you need to share that report with the RE and EPID unit, and you need to report that information in the MOH Office Vaccine Movement Register. So everything need to be done, right? The other one is if the temperature has gone below 0. So how to decide and how to make sure the safety of the vaccine. So that is again the same principles. You need to check whether fridge your ILR is in the same trouble. So then immediately transfer all these vaccines to cool box and then take the printout of the fridge tag. Then you get the additional information from the fridge tag printout. And next, you check whether the vials are already frozen. So the liquid content has converted to solid content, that is ice. If the liquid vaccines are frozen, so that means you cannot use all these vaccines anymore in your immunization program. So if the liquid has not converted to solid, that is, if it is not frozen, only if temperature has gone below 0, so then you need to do shake test. So doing shake test, so now again you need to check the printout file, the maximum minimum temperature they reach. If it is now less than 3, for example, the first you need to do the shake test with pentavalent vial, but still all the vials containing TT. So you can do shake test. And even HPV, you can do the shake test, right? So now, again, if it is frozen vaccines, so we can use BCG, MMR, OPV, and JE in our routine immunization program. But the one thing is, according to the manufacturer's instructions, these days, we cannot use JE. As a general principle, all live vaccines we can use, but the JE vaccines available in our country. Now we need to keep that vaccine between 2 to 8. So if it is frozen, we cannot use without ensuring the safety of the vaccine. Now, another thing is to do the shake test, and you can follow this link. There's a nice video. You can see how the shake test can be done. So now, if the shake test pass, so then according to the results, you need to make necessary decisions on how to use all these vaccines. Again, if this kind of things happen, doing shake test, it is always good to inform your RE, get the help from RE, and always do the shake test as a team, including RE and MOH, maybe MOH, sister, the PHNS, SPHMO, by a team, right? So then you need to make decisions accordingly. So that is what I just wanted to discuss with you today, except all these vaccines management and cold chain monitoring. This is another, I will show you another slide and stop it now. So this is very important, this one. So giving vaccines, after make suring all the things, how to make sure that all these things are taken place in your MOH office. So all the immunization data, you need to enter all these registers. This is clinic immunization register and clinic summary. And at the end of the month, you need to send this 527 report. And then you need to enter all the immunization data into ERHMIS system and ENIP system. And ENIP will be a new one from January onward. And at the same time, in your vaccine movement register and clinic vaccine movement register. So if you follow all these instructions, which is a must in terms of achieving our national immunization program objectives. So it is the responsibility of all of us to ensure all these methods are live and active, to make sure that each and every client receive a good quality potent vaccines through which we can ensure that the expected level of immunity is there within the community. So that will lead to achieve our national immunization program objectives. Thank you. If you have any problems or any queries, we can discuss it now. Any problems or any issues or any yes.
Thank you so much, sir. The wonderful vaccination message from PH particular, one message from PHA. Today I the good message. Thank you so much. God bless you, sir.
Okay, you are welcome.
If you all have any questions, you all can unmute yourself and ask.
Very much, sir. This is a nice lecture for.
We can't hear you. Please unmute yourself and
Sir, thank you very much. This is very wonderful lecture for us. Thank you very much, sir.
Okay, you are welcome. We make sure that all the things are implemented within your MOH office, okay?
Yes, sir. We definitely do.
Yeah. So if they don't have any issues to be discussed anymore, so then we can wind up it, no?
Okay, sir. Thank you very much.
Thank you, sir.
Okay.
So as we conclude today's program, I would like to extend my heartfelt gratitude to all of you for your active participation and engagement. A special thank you goes to our speaker, Dr. Nimal Gamagedara, consultant epidemiologist, for sharing his invaluable knowledge and expertise on correct stock management of vaccines and cold chain maintenance. Your insights have been incredibly enlightening, and we will undoubtedly guide us in our work. We also wish to express our appreciation to the College of Community Physicians of Sri Lanka and the Provincial Directorate of Health Services, Western Province, for organizing this impactful session. Lastly, thank you to our organizing team and everyone who worked behind the scenes to ensure this program's success. We look forward to seeing you at our future sessions. Have a wonderful day. Thank you.
Thank you.